The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today, you pick the topic. Most months we have a dedicated theme to our show. Today, we are answering all those general health questions you've been wanting to ask. If you have any questions like when are colds the most contagious, or should you use ice or heat on muscle pain, all those types of questions, give us a call now. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Gregory Appert with Boylan Healthcare and Dr. Mary Valenta with Garner Family Practice. To call us here at Rex on Call, just dial that number on your screen in Wake County. Call 919-744-3876. Outside of Wake County, toll free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. You can even find us on Twitter at Rex Healthcare. Use the hashtag RexOnCall. Now, in addition to our experts on our couch, we will bring you insight from some Rex specialists across the health spectrum. First up is cardiologist Dr. Bruce Usher. When folks find out you're a cardiologist, what do they ask you?
Oftentimes I get the question, mom or dad or my best friend or my brother just had a heart attack. What can I do and how do I find out if I have heart disease? I do think it's an opportunity for them to take seriously their risk. Hopefully will trigger them to lead a more heart healthy lifestyle going forward. So sometimes it takes a little scare like that for them to get serious about their health. I think it's a good thing. We ought to take advantage of that. We're busier, or we seem to be busier. And I think it just takes away that time of getting outside and running around and doing activities as opposed to picking up the phone and taking care of everything.
Joining us now, Dr. Gregory Appert with Boylan Healthcare and Dr. Mary Valenta with Garner Family Practice. Now, Dr. Usher talked about a lot of obesity and heart disease, and already we have a question in. How do you treat high blood pressure without medication? This is from by email from Pittsburgh.
Well, I think the best way to treat high blood pressure without medication would be to watch your diet. Salt in your diet is the biggest problem with high blood pressure, as is obesity. So if you can lower your weight, a lot of times you can lower your blood pressure, but definitely watch the salt.
Okay, and in terms of lifestyle changes, so we have, is it strictly losing weight, or what about being active?
Well, activity will help you lose weight, which will also help your blood pressure, but being active every day would be definitely a plus.
What are some ways you think, or do you recommend to your patients for a beginner to get active? You know, they always say, like, talk to your doctor beforehand. I mean, what are some ways to start an exercise routine?
Yeah, I don't think there's any true template out there. I like to tell patients that if you're active aerobically for at least 20 minutes a day, more days during a week than not, you're doing a pretty good job starting out.
And what do you think about those little Fitbit monitors? One of our docs we had talked to recommends, you know, kind of keeping track. Is there a goal for those? Do you guys like those?
I think it helps keep people on it, and if they like the technology and they're willing to use the technology, it can definitely be a benefit. The biggest recommendation is that you should have 2.5 hours of regular physical activity in a week of moderate intensity, and then you should have 2 days of weightlifting, muscle building also.
Okay, and that seems pretty intimidating for people. What is moderate? What is moderate activity?
That's a good question. I think moderate activity is anything where you're getting your heart rate up above its normal resting heart rate for an extended amount of time. There's nothing wrong with getting it up and getting it down and sort of mixing up your aerobic activity, but that's essentially what I'd term moderate.
Okay, and I hear the phone bank over there. I'm hearing a lot of diet, people asking about diets over there. I'm hearing that being dropped a lot. Is there it seems like those paleo diets are really the high protein, low carb diets. You're shaking your head. Yeah. What are your thoughts on those?
The biggest thing with losing weight is probably everybody's number one goal. Losing weight, you have to increase your activity. and you have to decrease your caloric intake. Now, if you decrease your carbohydrate intake, a lot of people do lose weight, but most of those diets you can't stay on forever. You really need to choose a lifestyle change instead of a particular diet that you're going to try to stay on forever.
What do you think?
Yeah, I mean, I agree wholeheartedly. I think if you treat it like a math game, if you burn more calories than you take in, you will lose weight. That is indisputable. So if you put the balance sheet up and you decrease the calorie intake, increase your exercise, and shift that balance sheet, you're going to have success.
It sounds so simple when you say it like that. So why do we have this obesity epidemic in our country?
Actually, the recommendation is if you want to lose a pound or 2 a week, that you should decrease your daily caloric intake by 500 to 1,000 calories. So, you know, everybody asks how many calories should I take in a day, and that number varies for every single person, but probably a good generalization is if you want to lose a pound or 2 a week, decrease by 500 to 1,000 calories in a day.
In a day. Wow, I have no idea. I need to keep track. Okay. So we also got a question in, should I weigh myself every day?
I usually don't think that's a good idea. The only reason why I say that is because it can be very discouraging. Weights can fluctuate on a daily basis, typically anywhere from 0 to 4 pounds in any direction. And if you're dieting and all of a sudden you gain 3 pounds in a day and you think you had a good week before that, you know, it can be very frustrating and can throw people off track. So if you're dieting and trying to lose weight, I typically will recommend not weighing yourself more than a couple times a month, quite frankly.
Oh, really?
But that's just for otherwise healthy people who are just trying to lose weight.
Okay. And I know this is, you know, being cold and flu season. There's also when to go to see your general practitioner and versus when to go to an ER. What do you tell your patients in terms of how sick they are?
Yeah, it depends on your symptoms. You know, if you have a high fever, you have a productive colored cough, those are probably reasons to see somebody sooner than if you have a runny nose that's clear colored and, you know, you don't have a fever. You know, the symptoms can progress as time goes on, and you're never wrong to go to the doctor and be seen, but a lot of times you can wait it out for several days before you actually come in, you know, and usually your symptoms are worse by the time you come in.
And I feel like a lot of children in my kids' different schools have been out with the stomach flu. What is the best way to guard yourself from that?
The best way is hand washing and essentially making sure the kids wash their hands and you wash your hands. One thing to think about too, though, is with the nausea and vomiting, some of that viral stuff can be aerosolized. So as children tend to get more sick, parents need to be careful of that because that's how they end up getting sick typically.
Yeah, and I got coughed in the face about 20 times this morning, so that's awesome. Okay, coming up, we'll hear answers on non-invasive ways to treat varicose veins. Give us a call now in Wake County, 919-744-3876. Outside of Wake County, toll free 877-277-6252, or email us your questions to rexoncall@rexhealth.com. Stay with us. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on all aspects of health and wellness and prevention. If you have questions for our experts, call in now in Wake County, 919-744-3876. Outside of Wake County, toll free 877-277-6252, or email us your questions at rexoncall@rexhealth.com. Tweet us. We are everywhere at Rex Healthcare, #RexOnCall. Now let's check in with Dr. Bobby Mendez with Rex Vascular Specialist with answers to questions he often gets about varicose veins.
Technology of taking care of varicose veins has significantly improved over the course of the last 5 to 10 years. Now, most of the interventions or the procedures done to take care of veins is actually done through small needles, accessing the patients in a clinic as opposed to having to come to the hospital or to an operating room. So what has really advanced the most is the minimal invasiveness of it. And because of that minimal invasiveness, it has become a quick outpatient procedure, oftentimes taking about 5 to 10 minutes to take care of it.
So that's great news if you have varicose veins, for sure. Okay, let's get to these questions. This question's from Durham by email. Adaira's ears have been ringing for 6 months, and she can hear my pulse in the ear. Could it be a pinched nerve or something else?
Okay. Well, when you say chronic tinnitus, which is ringing in your ears, the first thing I think of is, are you taking daily aspirin? Because aspirin can cause tinnitus. So that would be one thing.
Okay.
If she's not taking aspirin, she definitely should have her ears examined. You know, does she have wax in her ears? Does she have eustachian tube dysfunction where the ears aren't draining properly? Does she need more imaging, you know, CAT scan or, you know, other imaging of the ear and the head itself? So I would definitely say for 6 months she should be seen and be evaluated.
Okay. This is from Lewisburg. She's 72 years old. She walks 3 miles a day, but she has arthritis in her left shoulder. What is the best over-the-counter medicine for arthritis?
That's a good question too. If you're 72 years old, you have to keep a few things in mind before you start over-the-counter pain medicine. Do you have high blood pressure? You know, what is your kidney function? In a lot of people, non-steroidal medications are a good idea, ibuprofen, naproxen, things like that. But if you have other underlying medical conditions, Tylenol may be the best bet.
Okay. This is Jean from Durham, has had knee replacement 5 years ago, still has trouble bending her knee, and it doesn't straighten well. She's 82 years old. What do you think?
I'm certainly no orthopedist. Probably something that would be responsive to physical therapy, I would imagine. Sometimes those knees tend to loosen up, but usually that takes 10 to 15 years over time. And if it's only been a year, I would imagine PT. And if that doesn't work out, definitely see your orthopedist.
Okay. This is Jerry from Fayetteville. He has restroom frequencies, has concern about why he goes to the bathroom so frequently. And at this point, he's not been tested as diabetic.
Right. The first thing I would recommend is see your physician, get some basic lab work done, and have a urinalysis, because probably the biggest thing with urinary frequency that I would think of is diabetes. There's plenty of other issues, prostate issues can cause that problem. But definitely, if he has a concern, I would definitely be seen and have it worked out.
And things that can be, you know, that treated with medicines, those sort of things.
Sure.
Yeah.
Oh, definitely.
Okay. This is Vivian in Raleigh, wondering about nasal sprays. Are they all the same? What makes one better than the other?
They are not all the same. There's various nasal sprays and decongestants depending on what you want to treat. Typically, for people who have allergic and even some infectious viral rhinitis, sinusitis, I'll use nasal steroids. They're relatively safe for a short period of time. One thing I do stress patients to do is avoid long-term Afrin use. That can actually make the rhinorrhea worse over a given period of time.
And we're heading into allergy season with all that lovely yellow stuff going to be snowing down on us soon. Do you have sprays or anything you recommend for folks to kind of stay ahead of that?
Well, now, you know, the great thing is there's lots of medications that were prescription that are over the counter. There's lots of different antihistamines that you can try that are non-sedating, unlike the old ones. And actually, some of the nose sprays, actually one of the steroid nose sprays has gone over the counter too that you can try for allergies.
And it's such a hot topic. We have a whole show devoted to it next month.
Oh, good.
Okay. Real quick, has a hiatal hernia, very uncomfortable, can't sleep well, and does not want to choose surgery. Is there any other option?
The biggest thing I would say is avoid tight-fitting clothes, because the tight-fitting clothes would push up on the hernia. You know, obviously, don't eat things that are spicy that would have the acid come up into your throat. But if it's that uncomfortable, surgery really is a viable option. What do you think?
It is, and if reflux is the discomfort, oftentimes if you lift the head of your bed up 3, 4, 5 inches at nighttime, that'll help out a lot. And then of course there's medication-wise antihistamines like Pepcid or proton pump inhibitors like Prilosec or Prevacid can help decrease that acid production and help with the discomfort.
Great advice. Okay, if you're looking for a doctor or need a direct referral beyond today's show, you can call Rex Health Net. Rex's free telephone information service. The number is there, 919-784-4490. Our operators will help you link up with the ideal physician. And we are back after the break to answer more of your questions. Give us a call, send us an email, or tweet us. We'll be right back. Welcome back to Rex on Call live here on WRAL. To reach us, just call those numbers on your screen, 919-744-3876 in Wake County. Outside of Wake County, call us toll-free, 877-277-6252. Email us your questions to rexoncall@rexhealth.com. And today we are talking about prevention in all areas of health and wellness. But first, let's check in with thoracic surgeon Dr. Richard Gillespie. As a thoracic surgeon, you're at a cocktail party or you're at church. Knowing you're a thoracic surgeon, what do people ask you?
Most commonly what people ask me about is smoking. You know, do I really have to quit? The answer is yes. A lot of questions about secondhand smoke exposure. You know, this is North Carolina. Everybody's parents and grandparents all smoke. Is that a risk factor for, you know, am I going to get lung cancer because my dad smoked? You know, and the answer to that is no. It is known to be a risk factor for developing heart disease.
Okay, on the topic of smoking, what have you guys seen that is most successful that helps people stop smoking?
I think it's very personal, but amongst each individual patient. But probably the most important thing is it's not such a medication thing, but it's picking a date, like committing to it, and then on that date saying this is the last time I'm ever going to smoke. And more to the point on that is identifying triggers where you do smoke, such as if you were driving in the car or talking on the telephone.
Yeah.
What
and
have
maybe
you.
finding somebody to
Sure.
support you through that.
That's right.
Okay. On to questions here. This is Sandy from Angier. Has bilateral, due to injury, plantar fasciitis on both feet? Or is there anything she can do to avoid surgery?
Yeah, there are things that you can do. Before you get out of bed in the morning, stretch your feet back. You can also use a soup can or a tennis ball to rub your foot on and kind of stretch that out. Anti-inflammatory medications are sometimes helpful, and they do sometimes do steroid injections into the foot for that.
I know that's a very painful condition. I feel like I have so many friends that have that.
Right.
So there are things you can do.
Sure.
This is Gladys from Fuquay. Weight loss is hard. I hear you, Gladys. I walk 5 miles a day and not losing weight. So if she's walking 5 miles a day, that's better than most people, and she's not losing weight. What's going on?
Again, I think that's one of the balance sheet issues where you got to figure out where your excess calories are coming from. I certainly commend her on 5 miles a day of walking. That's fantastic. I think people having a food diary is a great idea. Otherwise, it's very difficult to know how many calories you're taking in, but once you get that food diary, you know, you can't hide that from yourself. It becomes evident where your problems may be.
Right. Now, this is questions from Durham. Diagnosed with pre-diabetes, and sometimes I want dessert. I understand on that one again. Can I have any dessert like once or twice a week if they're pre-diabetic?
I think if you're pre-diabetic, the biggest thing is to be, you know, knowledgeable about the things that'll make your sugar go up, and you don't have to deprive yourself of a dessert once or twice a week. But, you know, check in with your doctor. If it's worsening, then you'll have to tighten your diet even more. But I wouldn't say to just knock out all the sweets completely forever. No.
That'd be very hard.
No.
Okay, next up we're talking with Dr. Dustin Bermudez, a bariatric surgeon who is often asked about the differences in what he does compared to plastic surgery.
Well, we usually don't give them like a lineup of celebrities and who they want to look like, but I think that's actually a big difference between a plastic surgeon trying to achieve a cosmetic change versus a bariatric surgeon, which I really think is more like a metabolic surgeon. You really reset people's metabolism, and I think one of the most exciting things about being a bariatric surgeon is that you really cure people of disease, and so to really cure people of their diabetes, and more importantly, to give them a new lease on life. Being able to do things they couldn't do before, like ride a roller coaster, play with their kids, sit in one seat on an airplane, is a pretty powerful thing.
And talking about a cure, bariatric surgery, a cure for type 2 diabetes, not type 1 diabetes. And have you seen that to be a success with any of your patients?
I have.
Yeah.
I think at the end of the day, it's all basically, have you lost weight or not?
Right.
And so if it's through bariatric surgery or diet and exercise alone, that's what ultimately ends up correcting the problem.
Okay, awesome. We'll have a final round of questions after this break. This is Rex on Call. Stay with us. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions. Let's get to it. This is Sherry. She suffers from IBS with constipation. What can she do about it?
I find that most patients who are constipated are severely lacking in fiber and water. And if you can increase both of those in your diet, your constipation is going to get significantly better.
Okay, simple as that.
And exercise. Exercise helps constipation too.
Okay,
So,
okay, Sherry. Robbie, what is the difference between diverticulosis and diverticulitis?
Well, diverticulosis is common, and it's found in a lot of people when they have their colonoscopies and you get your printout, it says that you have diverticulosis. That's just little outpocketings in your colon that happen over time. A lot of times from a lower fiber diet that us Americans eat. Many of us have diverticulosis, but diverticulitis is when those pockets in your colon get infected and require treatment. So diverticulitis is definitely different than diverticulosis.
And do one or both require treatment?
Diverticulitis definitely requires treatment. Diverticulosis, the best thing that you can do to try to make so that you don't get more is to increase the fiber in your diet.
Okay. William wants to know, he's a vegetarian and wants to know why he needs B12.
B12 is necessary to make red blood cells, essentially.
Okay.
So
You need it.
you need it. You need it or you're going to be anemic.
Okay.
And other problems will come along with that as well.
And Michael appears to be getting the cough that we all have been hearing, and this has been the chorus of coughs everywhere I go lately, and has been coughing up a lot of stuff. Should he go see a doctor? What is this?
I would definitely see your physician. You know, do you have a fever? How long has this been going on? What color is the stuff that you're coughing up? But if it's been going on several days and it's not getting better, I definitely would recommend that he see his physician.
Okay, 53-year-old healthy guy, but he feels dizziness between sitting and standing. What could this mean? Some dizzy spells.
Yeah, that can mean a lot of different stuff. We call it essentially orthostatic hypotension. Anytime you're going from laying to sitting or sitting to standing, you're getting an acute drop in your blood pressure. In most healthy people, it could be some general dehydration. But if you're on hypertensive medications or have other medical problems, you should probably go see your doctor about it because it could be something more significant.
Okay, how do I lower my triglycerides?
Well, triglycerides are a measure of circulating fat in your blood. So decreasing the fat content in the food that you eat and increasing your exercise can help.
Okay, this one, I'm no doctor, but urinates often at night, takes a diuretic, but gets no better. Doesn't a diuretic make you go to the bathroom?
Yes.
Okay, so maybe don't take a diuretic.
So maybe see your physician and ask them if you could switch your diuretic
Yeah, to something
else just to see.
Are there medications that can help you from making those frequent trips to the bathroom in the middle of the night?
There are, but it depends on what the underlying reason is for the frequent urination.
So go see a doctor.
Go see your doctor, but also if you're taking the diuretic at nighttime, take it in the morning.
Oh, okay.
That's a common mistake people make that can help that problem.
Oh yeah, okay. This is Laura. Are there diet and nutrition options for Graves' disease?
I really don't know of any in particular. I would recommend that she consult her physician.
Okay.
Yeah, I'm not aware of any.
Okay, so talk to your doctor about that one. And after hysterectomy, Donna wants to know if she still has to get pap smears.
Well, it depends on why she had the hysterectomy. If she had it for cancerous reasons, the recommendation is that you still have your pap smear. If she had a total hysterectomy, her cervix, uterus, her ovaries removed, the recommendation is that you do not need to continue doing pap smears, but you should continue to do exams. So some people confuse that and they just don't go back for the exam.
Those new guidelines were very confusing. Okay.
Right.
As always, consult with your physician about any health concerns. And thank you guys so much to our experts answering all these varied questions. And thanks to our phone bank today that are busy taking calls still. And be sure to join us Monday, April 21st for our next Rex on Call. The topic is allergies. You can email us ahead of time with your questions on allergies to rexoncall@rexhealth.com. That will be a good one, and I will have a lot of questions myself. We will see you next time. Thanks so much for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.